Hi everyone, I'm Chelsea Dunstan. The topic I have chosen to focus on is the Ebola crisis and the mandatory 21-day isolation for all those who have traveled to countries where Ebola is present or have been in contact with those who have tested positive for the disease. I personally believe that this is a very reasonable and potentially effective policy in stopping the spread of Ebola in the United States. I also believe that it is our duty as healthcare workers to protect society. Therefore, if we choose to volunteer abroad to fight this disease, we should do what is necessary to stop it from potentially spreading here at home, even if that means being quarantined for 21 days. In order to research our House and Senate members, I have visited the websites of Kay Hagan, Richard Burr, Richard Hudson, and Robert Pittenger. I have also started following each of them on Twitter. Based on their tweets and press releases, each of them currently are in support of the 21-day mandatory isolation policy. Robert Pittenger has tweeted several times in response to the Ebola crisis. He tweeted about a letter he sent to Obama on October 8th in regards to protecting society and preventing the spread of disease, about how the letter was later co-signed by 25 members of Congress, and how we are finally implementing steps to protect fellow Americans. Richard Burr has mentioned in his tweets that Ebola should be treated as a public health crisis, not a political one. In tweets from Richard Hudson, he calls for enhanced travel restrictions, a temporary suspension of visas of those from West Africa. He also mentions that, in quotations, we must take every common sense precaution to prevent the spread of Ebola and protect the health and security of Americans. End quotations. Kay Hagan has not posted any tweets in regards to the Ebola crisis. All posts are political against Tom Tillis. However, Kay Hagan does speak on her website that she supports a travel ban for non-U.S. citizens traveling from West Africa in order to prevent the spread of Ebola to the United States. Although all of our North Carolina representatives that I've researched are for the 21-day isolation period, President Obama has voiced his opposing opinion. In an article posted by the New York Times, the first line reads, quotations, Obama forcefully rejected the idea of a quarantine for medical workers returning from the Ebola-affected countries, end quotations. The article implies that Obama's opinion of the quarantine is that it is based on not facts, but from fear from society. I live in a small town just outside of Charlotte. Although I do not feel that we are at a threat for Ebola, it is our job as nurses at our hospital that we be prepared for anything that may come through our door. We have implemented a protocol and screening tools for all patients who come in, whether it be through our surgery center or our emergency department. Patients will be screened by all departments. Many of our staff members have been trained in proper PPE application. We also have a designated facility to send any patients who may screen positive for the disease. This facility would be CMC Main in Charlotte. At our local hospital, if a patient were to test positive or screen positive for the disease, we would put them in isolation. We would not even draw blood on this patient. We will send them straight to CMC Charlotte, to a facility better equipped to handle this patient. Although I do not feel like we are at risk and we have anybody locally who have traveled to the Ebola-stricken countries, it is still our duty as nurses and healthcare workers to protect society. Whether we have to stay in isolation for 21 days, miss out on our family's events, whatever it may be, that is our duty to society. Thank you.